Morning and welcome back to Morning Express. It is now 8:22 a.m. and for the next about 40 minutes or so, we're all about maternal health, important subject. And joining me in studio this morning, gentlemen, to talk about that, I know, and we'll get to talk about their interest in the same and why they feel more men perhaps need to be speaking out on this very important subject, touching our mothers, our sisters as well. Dr.Abbas Gullet, Kenya Red Cross Secretary General, also Vice President for Africa, the International Federation of Red Cross and Red Crescent Societies. I got that right?
Yes, ma'am.
We have Mr. at my extreme left, Saddharth Chatterjee, the United Nations Population Fund, UNFPA country representative. And in the middle with us is Dr. William Maina, who's head Directorate of Preventive and Promotive Health with the Ministry of Health. Thank you, gentlemen, for joining us this morning. So when we're talking maternal health, the figures in terms of the deaths we see every year, 6,000, perhaps even to 8,000. That is staggering. And we'll begin with you, Dr. Maina. Why is it we're talking still so many deaths in this day and age?
Thank you. I think the issue of maternal death is the most touching thing in this country. And why we experience this kind of deaths is because we still have very low turn-up of mothers who come to deliver under skilled delivery. You find that from our Kenya Demographic Health Survey in 2009, only 44% of all pregnant mothers delivered under skilled delivery. And as a result, over 56% of all pregnant mothers delivered somewhere at home on the way, and this way complications of pregnancy were unable to be detected in good time. And that is why we find so many mothers dying, because they come when it is too late to the hospital, when intervention to save them cannot be put in place. And when you look at the statistics, you find that majority of these deaths are rising due to pregnancy-related complications such as bleeding, obstructed labor, and infections thereafter because of delivering under unhygienic or unhealthy conditions.
Okay. Dr. Gullet, is it just because they're not going to hospital? Because I think there's also a bigger issue of there are those who go, but there isn't that expert help. There isn't a space or place for them, you know, to deliver.
I guess that is true in that way too. But I think for me, as Dr. Maina said, the fundamental thing is to get mothers to deliver in a facility, in a proper health facility, or to be delivered by people with that knowledge. And I think this is where the gap is for me. And I can use many examples that Kenya Red Cross has been involved over the last few years. Example, now we just started something on a mobile technology where we're saying in 2 districts, very hard to reach district of Tana River and Garissa, in remote areas, where we've been working with communities and community health workers to inform them on the importance to go for checkups. I mean, 9-month pregnancy period, we say at least minimum accepted is 4 times. You should go and see an expert who then can help you for your antenatal care and checkups. We are now using technology, we're able to remind them their time is due, that they go. Even if they don't on telephone, we are saying we use the husband's phones to remind the husband to remind the wife that they need to go there. We've started a few months ago about ambulances, and today we are running the largest private ambulance service in this country. We started in 5 counties: Kisii, Kakamega, Bomet, Garissa, and now tomorrow we'll be launching Mandera. Using that ambulances, we've seen uptake. Over 55% is on mothers being taken for deliveries to health facilities that otherwise would not have been able to go because of the distances, because of maybe complication, and because, as you also partly say, of not having that expertise person who then can deliver the mothers when they need to deliver.
Yeah. What do you have to say about the numbers? Because it is worrying, and we'll talk about the budget and what kind of money we are seeing being directed to that direction. But it is worrying that we are seeing so many mothers die.
You know, first of all, I think Kenya deserves a lot of credit that the First Lady of this country has really taken that as a yeoman call, as a clarion call, and really bringing everybody together around the Beyond Zero campaign, which is about protecting mothers, which is about making sure that they survive. And yesterday when I met her, there was a very clear clarion call from her. She says, you know, no woman should die giving life. I think that's something that should rally every Kenyan around this country. Kenya has done very well on several factors around the Millennium Development Goals, which end in 2015. If there is one place which is challenging, as His Excellency the Cabinet Secretary for Health has said, if there is one place that challenges us, it is the Millennium Development Goal, which is number 5, which is about the reduction of maternal mortality, where on an average 15 women and approximately 290 children die daily in Kenya. So, you know, those numbers add up. I think what is critical here is to look at innovation. And I think what Kenya Red Cross, for example, is doing with mobile ambulances to be able to reach hard-to-reach areas, what Dr. Maina said is facilities where we have trained, skilled birth attendants who will be able to deliver those children. We need a combination of the two. Right now, what we need to do is to tell the international community, to tell the world that, look, Kenya can do it.
Yes.
And now to accelerate achievement of MDG 5, which is actually talking about reducing by 75% maternal deaths. We are not there yet, but we can do it. And I think there's the political will. Where it'll really matter is when the county governors take this as their legacies, that in their respective counties, no woman should die giving birth.
Right. And we'll talk about the Beyond Zero campaign and just get an understanding of where it is now. But just to go back to, in terms of where also we have loopholes, and as far as this is concerned, the president, you know, waived fee on, you know, maternal services for mothers going to public facilities. That is a good thing. It was a good step forward. But for you in the ministry, why then do we had a story the other day, a woman going to hospital to give birth, and, you know, there were no rooms available. She had, you know, to give birth on the floor. And there have been other horrific tales that we have heard about. And the question of, because you have both mentioned it, the skilled attendants, we don't have as many to be able to cater to these women. So whilst they need to go to hospital, they need to take the antenatal care more seriously, but are they being, you know, complemented in as far as meeting them at their point of need?
I think the issue of access has two prongs. One, there is access due to geographical reasons.
Yes.
People living very far away from health facilities, and probably the roads to the health facilities are not actually accessible. And that is where the issue of ambulances and referral comes in.
Okay.
That is where the Ministry of Health is coming in and introducing the community health strategy, where now we train community members to advise mothers at the village level and be able to detect those who have complications earlier and refer them in good time. The next thing is that there is the cost limitation. And we are happy because His Excellency the President introduced free maternity services starting June last year.
Yes.
Because the other issue of constraint to access was the inability to pay for the services, and this one has been removed. The other access issue is, do we have facilities that can provide the quality that we require in terms of the mother who turn up in the hospitals? And this is now the next stage we are talking about. How do we now strengthen our health systems to be able to meet the demand for deliveries that is coming to the hospitals? If you look at the statistics from the time free maternity services were started last year, we have seen the level of mothers who have coming to deliver under skilled delivery in the hospitals increasing very highly. We have seen actually a change from 44% of the mothers who are coming to deliver before the program was put in place has gone up to 66%. And we are seeing these figures rising even much more. So we are saying that we need also to expand our services, our health facilities, to be able to cope with the rising numbers of mothers who are demanding these services. And this is where now the partnership of the Ministry of Health and other partners is very key in terms of even strengthening the health facilities, particularly providing the equipment and environment to support these deliveries, and two, to retrain the health workers so that now they have their up-to-date skills to be able to provide that skilled delivery we are talking about.
Okay. And if you're watching this, you can be part of the conversation. Our phone numbers are on your screen. You can call in and contribute. We'd love to hear from you. Doctor, you've traveled most parts of the country, been able to see some of the really situations that are on the ground. Would you paint for us a picture for those, you know, middle class sometimes is accused of being the people who really don't have an understanding of how it is at the very grassroots levels for the poor, low-income earners. Paint for us a picture of what really the situation is.
Yeah. No, Sophia, I think the reality on the ground is that, as Dr. Maina says, there are serious gaps, and if one were to talk frankly, out there in many parts of these countries. where you talk of someone being away from a facility 40, 50, 60 kilometers, even 100 kilometers. In many parts, you can talk from West Pokot to Turkana, to Samburu, to Marsabit, to Moyale, to Mandera, to Wajir, Isiolo, Garissa, Tana River, Lamu. Lamu, people talk about exotic islands of Lamu, but there are mothers who die in high seas almost 4 or 5 that would die on the high seas from Kizingitini Islands or in Faza coming to Lamu main island.
Wow.
The Lamu district, or now county hospital itself, that was built many years ago, doesn't have a lot of these basic services. I remember after the fire in Lamu Faza about 5 years ago, we had to build a health facility there, but a maternity wing. We've done maternity wings in Isiolo, in Sericho, in Isiolo itself. We've done it in Turkana, in Kaikor, in many places. So I would agree with what Dr. Maina is saying, that there is a need, since health now is devolved, county government should take more responsibility in building these facilities that would provide for maternity wings in many of these facilities, and then equipping it. Just 2 days ago, the Minister for Cabinet Secretary for Health was launching, equipment that has been purchased through Kenya Red Cross, backed by funding through Global Fund by the government, to go to 480 health facilities, and part of that was going to be for maternity, for MCH, others going to be cervical cancer, and for other treatments. So I think the government in that case, as Dr. Maina is saying, in partnership, and this is I think the beauty of it, that government has realized they can't do everything on their own. So whether it's UNFPA or various UN agencies or the Red Cross or other organizations, they need to bring partnership with the private sector, with the UN agencies, with donor government, to take this to the next mile. Because today, and you rightly said, we'll come back to the Zero campaign, Beyond Zero campaign by Her Excellency the First Lady, that will only be achieved if every mother is able to deliver at a facility. Okay, if that doesn't happen, then we've gone nowhere. And today we're saying it's about providing even mobile medical outreaches that mothers can deliver. And today, where I talked earlier about ambulances, we're actually delivering people in our ambulances. I can give you statistics for Kisii, for Bomet, for Kakamega, and for Garissa, just over the last 4 months. 600 here, 400 there, 500 there, who are now being taken for these deliveries. But as you rightly earlier said, and Dr. Maina confirms, we need to now invest more in the facilities so that we can cope with this huge load of people who are now, because of getting into the free services, that can now access these services. Okay,
so you're involved in just coming in and bridging those gaps as UNFPA and other organs and stakeholders that are coming in to help the government to tackle this problem.
Sophie, when I came here, there was a marching order given to me by the executive director of UNFPA, Dr. Babatunde Usataiman. And he said to me, he said, do everything possible to accelerate on MDG 5 in Kenya. That is one thing that will actually help reshape the human development aspect of Kenya. So, in my view, I think it'll have to be a combination of the two. You can't just build facilities overnight. These things take time. And there are many places in India. I come from a country which has seen traditional maternal mortality rates which skyrocketed, but have managed to control it simply because, again, innovation became a part of that. Doing a combination of mobile health services, doing a combination of health facilities. But what is most important is involving men in this. Men are the decision makers.
And here you are.
Men need to be the drivers of that change. Take, for example, I was in Turkana recently. It was interesting to see that in the refugee camps, where UNHCR and its partners, the local government, have done an incredible job. 94% of the deliveries take place at facilities inside the camp. Just come out into the host community, 94% of the deliveries take place at home. Now that is the wide disparity which is there. I think we need to kind of close that disparity, and it's possible because what Kenya has is the asset of terrific human capital. It's got innovation on its side. It's got great national institutions. It's got a very committed government, and it's got county authorities who can actually change the game. And I think that needs to be pushing through.
That needs to be pushed. We have a call online. Diana is calling us. Diana, good morning.
Good morning. How are you?
Excellent. Thank you so much for calling us. Go ahead with your contribution.
Yeah.
Uh-huh.
And they wanted to ask if when a mother is pregnant and she's paid for the nutrition, we have some amount of money that is supposed to pay, because I was once there, and when I was there, I was so surprised to see a woman. She doesn't even have papers, even out of more than but at the end of the day, she not received the results for the checkup until she paid 300 shillings. I don't know whether it's right or is it okay?
All right, Diana, your line is really not clear. I could barely get what you've said, but hopefully you can call us back and we can try to get a clearer line for you. But I understand we also have Helen on the line. Helen, good morning.
Hello.
Hi.
My name is Helen.
Yes.
I want to contribute on the maternal health topic.
Sure, go ahead.
I'm glad that you're discussing a very passionate topic to me. My question is, I'm a nurse, and the government has done a very good initiative of offering free maternal health. My problem is with the government, why they have promised to build the capacity of the nurses, the service providers in hospitals. They have not added the staff in the hospitals. So many clients have increased, the flow of clients have increased in their health facilities, but there is no enough labor to cater for this staff. Like if 10 mothers work to deliver in a hospital, there are only 6 nurses on duty, you can only first attend to the first 6. The other 4 are compromised. Why aren't they adding the number of staff in the hospital? Why are they motivating the service providers? They're having very good initiatives on paper, but I think they're not implementation as quickly as they say they will. And the MDGs have timelines.
Okay. Helen,
Yes.
thank you. Thank you so much for watching and for calling this morning. And I'll come to you, Dr. Maina. Very important point there. It's good on paper, but it always boils down to implementation. And she's talking from, a knowledge point of view. She's a nurse. And I was just talking to my colleague earlier who covers a lot of these health stories for us. And she was telling me for Kenyatta, for example, you have 1 nurse to 20, pregnant mothers coming to give birth. That's huge. So are we seeing that kind of initiative to also up these numbers?
Thank you. Just before we come to that, Diana was raising the issue of what is free maternity services. I got it. I want to inform all of us that free maternity services is not just the delivery of the baby. It is the whole package of the 4 visits to the clinic and the delivery process until the mother goes home with a baby.
Okay.
So the course is from the time they go for the first visit after realizing they are pregnant, and the 4 recommended visits up to the time of delivery, and then during delivery and the time they are going home. What we are giving is a package. It's a full package for maternal services, so that we are able to follow up the mother for the recommended 4 visits, so that we're able now to recommend and detect complications early enough and do interventions so that they can have a healthy baby after delivery. On coming to the next question, I think the person who asked the question is aware that in the current financial year, the government set aside money to actually recruit 9,000 health workers all over the country. And this money was taken to the counties. What we are saying is that, like my colleague here, Dr. Abbas, has said, the counties have now to take this issue very seriously, and once it comes to, because the health services have been devolved to the counties, the county government have to hire and manage the human resource for health at the county, including recruiting the requisite human resource to take care of the services according to the needs of the county. And we, as the national government, we made a recommendation to the counties on the criteria and the numbers of health workers that were to be recruited with the amount of money, about 3.8 billion, that government allocated in the current financial year. In the current budget, we are also trying to work with the Treasury to ensure that we continue recruiting more health workers, so that in a few years to come, we are able to bridge the wide gap, because this country requires an additional 42,000 nurses to meet the service needs. We require an additional 20,000 doctors in the service, and this cannot be done at once. We have to progressively try to recruit more staff as the years go on. Note that there is also the attrition. There are those who are retiring, there are those who are resigning, there are those who are naturally going because of death. Okay. So we have to continuously replace the human resource for health as these issues do arise. And this is already not only in the paper, but it is there in terms of actualizing this. The other thing is that the government, through the last 5 years, through the economic stimulus package, we went ahead to actually construct one model health center in every constituency to increase the number of health facilities that are providing deliveries. And against every constituency, 20 nurses were recruited to man those health centers. These are efforts by the government to expand services and to take services nearer to the people. Okay. Now the onus is with the county government to ensure that those facilities are running and they will progressively ensure that we have adequate, if not enough, human resource to deliver or to deliver the services within those health facilities.
Yeah, you had a contribution.
Dan, I wanted to add on the question, particularly in the area where Kenyatta is being said to be overwhelmed. And I guess I'm speaking this from a perspective of even on the trauma or emergency services, that we should remember Kenyatta is a national referral hospital. Kenyatta is not your level 1, level 2, level 3, level 4, and level 5. So if the other facilities do not function at the capacity that they should, and as Dr. Maina is saying, these are responsibility for county government, Kenyatta is overburdened, and then we blame Kenyatta for anything and everything that goes wrong in this country and in this city of Nairobi. Kenyatta should be the last resort where someone goes to Kenyatta. Okay. They should go to Mbagathi, they should go to Mama Lucy, they should go to all these other facilities from level 1 up to level 5 before you even get to Kenyatta.
Yes. Dr. Maina, I'll bring this back to you before we move away from the funding and the kind of money that is directed to health, because the budget has been read tomorrow, and 4 billion shillings, many will say, is not enough to go to healthcare. And most of when you're talking about, and some critics have argued, you know, in Kenya will sometimes over-rely. You have UNFPA and other friends of the country, but there's too much reliance on that kind of funding that's coming to bridge those gaps. But the government in and of itself does not seem to have that kind of commitment, and yet people are dying. You have a sick nation, you're not moving forward.
Government through treasury alone cannot meet the health needs of this country.
But it could increase that funding.
And this is why we are talking about a comprehensive national health, social security for health, where we have everybody receiving a package of social protection in health, where you can everybody has a right to access to health. And this will only be achieved when we reform the National Health Insurance Fund to cover all, particularly the poor, because they don't have the money to meet the out-of-pocket cost of treatment, which is currently standing at almost 50%. Half of the cost of health is just people paying directly from their pockets. And these are people who are already pressured by other costs of living. So what you're talking is that the 4 billion is to meet this particular intervention of free maternity services. And what we are doing as a ministry is that the hospitals are getting monthly reimbursements for the deliveries they conduct. If a hospital X saying that we have delivered 1,000 mothers in this month, they are getting a given standard cost per delivery, and this money is given to them directly, immediately, after they submit the statistics. And this one has been happening. But you're saying for sustainability, can we have this program now designed in a way that every pregnant mother probably gets a subscription to an insurance scheme where they can just present their card and get all the package of service, and it not only cover the cost of that pregnancy and delivery, it can be able even to cover the immediate members of their family.
In your opinion, is that allocation sufficient for your work in the health docket?
I say it is for purposes of free maternity services. But the government has allocated more funding for other health services. This particular 4 billion is to cover the free maternity services.
All right. We have Solomon online, and we'll come to see it in a short while. Solomon, good morning.
Yeah, good morning all.
Thank you for calling.
Yeah, this is Solomon.
Yes, go ahead with your contribution.
Happen to know two of the people there, but just one I don't know. But my question is, the government seems to rely more on the private sector activities, like the donors and the NGOs, in that it has, like, with its view, some of the amount of money that is required in healthcare and budgeted the the health system because they benefit from those initiatives. And number two, as we are looking at the development of this country, we cannot move without the government help because the government help is very crucial since it is always on the ground more than any other system. Mr. Abbas Gullet is talking of what is on the ground, he's talking of hands-on, and he's talking of a reality on the ground. Dr. Maina is talking about administratively. My other friend from UN is talking from administratively. But let's look at things from a practical situation. Helen has spoken about nurses. It is true that is the practical there. The idea of government, the county government being told to employ is another story. What we need is that the practical part of it, whereby we have the nurses or not.
Okay.
Number two, these facilities we are talking about being given free maternity food, but where are the scans, which are very cheap nowadays? Where are the MRI facilities, which are cheap nowadays? The government can budget that for each county and make sure that each county has a small, like, a county referral hospital, so that the health centers will be feeding the county hospital, and then the county hospital should be feeding our big hospital, Kenyatta, which is overwhelmed because of mismanagement of the government system.
All right, thank you, Solomon, for watching and your contribution. Sid, please go ahead.
I think that's a great question, and I think Solomon has actually hit the nail on the head. What can we do practically to change the status quo?
Yes.
And this is exactly the discussion which I had with His Excellency the Cabinet Secretary, Mr. James Macharia, and then yesterday with Her Excellency the First Lady. Is, do you know, Sophie, that 10 counties account for close to 60% of maternal deaths in Kenya?
Wow.
That's right.
Yeah.
So the inequity within the country is huge. There are some counties which are doing exceptionally well, but there are 10 counties that we've identified, analyzed it statistically to look at the rate of maternal death. So what we want to do is focus on these 10 counties. Let's get the bottom line up. What does that focus mean? What we've thought of is, together with the Ministry of Health, UNFPA, the Kenya Red Cross partners, and particularly the UN resident coordinator here, Nardos Bekele Thomas, who's passionate about this whole issue of maternal health. We are coming together with the 10 county leaders, the governors, their health executives, coming together for 2 days next month actually, discussing how do we do, what are the practical actions, because the actions that you need to take, for example, in Turkana may not necessarily be applicable in Homa Bay. And you know, because of the diversity, so we want to look at it specifically. There is already a plan in place that the UN has worked on in terms of accelerating the Millennium Development Goals. So there are some very practical actions that can be taken. But Emmanuel, just going back to you, I think here is a moment for the governors to build their legacy, that each of these 10 county governors would say, during my time, maternal mortality rates dropped by X%. And I think that is where the final game will change. It will not happen in Nairobi, it will happen at the county.
The counties and practical solutions. And talking about devolution, last year those doctors were threatening to go on strike, saying that the counties are not prepared to take on the devolved services in as far as health is concerned. So where do we see that going? Because on one hand we see it's important and crucial that that happens as soon as possible, but when the doctors are running away from these county hospitals, because we know there will also their remuneration and all comes into play, and they will want to be where they are best remunerated. So we are seeing lots fine, they will come up in the counties, but people, they're not attracting the service providers to be in the counties, and the doctors have argued they are not ready to take on these services.
I think in the beginning there was a lot of fear of the unknown. The devolution issue was a very new thing to this country, and people were not certain, particularly health workers, that the county government would be able to take care of their issues as they wanted to be handled. One thing is that some people knew that they have worked for several years and they didn't understand how their services would be actually shifted from the central level to the county government. The second thing is that the health worker feared that the counties were so politically polarized that some people would be deemed not to be coming from a particular region and would probably be ejected and told to go where they originated from.
Right.
All those things because they come from the previous historical issues in this country about tribalism, about regionalism. All those things made health workers become very apprehensive, and they were fearing that their issues might not be handled very well by the counties. But when you look at the situation today, the issues have been settled down. All the health workers have been seconded to the counties, and the counties are handling their human resource issues very well. The other issue that health workers were fearing is the issue of their progression. If you're in one county, are you going to remain in that one county forever? Are you going to grow up in the profession line? Those are the issues that are now the Public Service Commission is trying to come up with a policy that addresses the issues of career progression, even as you work within the county.
Okay.
The other important aspect is how do we have equitable distribution of skills? Because every county needs to have specialists who can provide specialized or high-level specialized care so that we minimize the issue of having to refer everybody to Kenyatta. We need to build the capacity for high-skilled service at the county so that we can have our people at the county even having referral system within the county so that complicated cases can be managed at the county, and only very serious complications need to go to Kenyatta. Okay. This is the only way we are going to offload our national referral hospital so that it becomes a specialized hospital. Okay. The other aspect is that when you look at the budget in this country, I would also confirm to what he has said is that health is underfunded. 10-15 years ago, we made a declaration that we are going to actually reach to 15% of our national budget will go to health. As we speak today, it's around 6%. We are not even halfway towards that target. And it's only when we progressively continue to invest in health that we are going actually to meet the gaps that we are finding in this country. Okay. And therefore, we need to work towards having at least more than 10% of our national budget going to health. This is the only way we are going to actually minimize our dependence on partners and donors, and then starting now to own our health programs in this country.
All right, we have Ken on the line. Ken, good morning.
Morning,
Ken?
How are you?
Hi.
I'm fine, thank you. I'm calling from India. My point is we welcome the move of free maternal health care, but now the challenges are so various. I don't know what government is going to do to overcome this. One, right now, the maternal, you go to hospital, there's so many women moving into the hospital, but the staff, the nurses to attend on them, there are very few. That's the first point. Second point, you go to the hospital sometimes, there's no drug. You have to buy yourself those things. They require the requirement. So I believe there's no free maternal health. That's all you move to the hospital for assistance, then they're told to go buy gloves. Buy everything. Really, and they're saying it's free. Can it really work, really?
All right, good point.
And you get so many people dying on the line.
All right, Ken, thank you very much. Thank you for watching the show and your contribution, which I'll allow you to answer to. But let's talk about, maybe respond to that first, before we talk about the Beyond Zero campaign, that it's not really free maternal health because they are buying too many things.
Like we have said here with my colleague, is that the health services have been devolved to the counties, and therefore the county governments must ensure that they provide for the essential services that are supposed to be given at that particular level. We have a system of this in this country. We have the Kenya Medical Supplies Agency, and the counties have been asked to use that agency to have to source for their pharmaceutical requirement and non-pharmaceuticals. It's upon the county government now to prioritize their activities in the county and ensure that they have actually financed the necessary requirements for healthcare in this country.
All right, Dr. Gullet, talk to us about this subject that is very close to the First Lady's heart. Beyond Zero campaign, we saw her run the marathon. She went to London as well. Where are we now in terms of the campaign?
I think even before I talk on that, Sophie, I'll just go back to the question that was asked, but also the answer by Dr. Maina. Right. I mean, as you said right from the outset, I've been to many counties and we've seen what's going on. We have had only 1 year of devolution, and the people expect miracles from, hit the ground running. And this is typical Kenyans, and we should be more patient. Although we should not be patient about people's lives and people's health, But equally, as Dr. Maina said, there were a lot of challenges, and those challenges are being addressed, and they will not be addressed overnight. But I think there is some level of calmness taking place. I was in Kisumu yesterday in the afternoon. I was meeting the county health MCA, the MCA committee for health from Kakamega, who are in Kisumu, who wanted to talk about ambulance services, because Kakamega County took ambulance services. So the MCAs or the county assembly were asking, you know, what is these ambulances, how they are working. On the other hand, they were excited about what differences these ambulances have made to their population. 635 mothers in a period of 3.5 months have been delivered to hospital, and some actually have been delivered, mothers delivered in these ambulances. The question of staffing and nursing that has been said, I think Dr. has said it clearly, and I just want to echo it, that there is shortage. There are shortages of manpower, because a lot of Kenyans are going around the world to also look for better opportunities and greener pastures. I think the challenge is our institutions of higher learnings. How quick can we turn around new doctors, new nurses? In fact, as Kenya Red Cross, we've even decided now to open up a school for nursing. From September this year, we'll be running our own nursing school to have more people into the market so that they can get to work for government or private sector, or even go and work abroad. So I think it's a broader issue, but again, as Dr. clearly say, because of the underfunding that the government over the years have not been able to meet those targets, then obviously there'll be shortfall. So I think all of us should work through county governments and national level to push the government and the people who make the budget to ensure that more is provided to this. But going back to the question of the Zero campaign.
And we have very little time left. Yes.
I think one cannot just wonder but to praise Her Excellency the First Lady for having been bold enough from the word go of the presidency of President Kenyatta for her to be on the forefront on this matter. For her to have gone through the grueling of the Nairobi Marathon and the 42-kilometer one of London. And I think the impact that has had globally is just amazing, that people couldn't believe that First Lady of her nature would be able to do this. I think the First Lady in the whole world to have undertaken that. And as Kenyans, we should be very proud. From where I come from as Kenya Red Cross, I can only say that from Kenya Red Cross, we would be very happy at all costs to support that initiative, largely through the ambulance services that we have, largely through the network of volunteers. We've got the largest volunteer network in this country of community health workers who can go out there and make the difference to achieve that goal. Okay.
All right. Less than a minute.
Sophie, finally boils down to socio-cultural issues as well. You could have the government doing everything possible, but if the woman's husband says, no, you have to deliver at home, and the TBA, the traditional birth attendant, will do it, that status will not change. So there are many issues of inequality that also need to be addressed. So I think what needs to be put at the center of this is civil society organizations, media like yourselves, need to take much more responsibility of really saying the sexual and reproductive rights of women, their health is non-negotiable. That is the foundation of Kenya, that is the foundation of our society. And I think equal amount of push from media, equal amount of push from civil society, changing a lot of these socio-cultural norms will actually benefit a lot. So it will have to be from the micro level to the macro level. But again, I'll go back to saying it is critical that we get the county governors to really lead this charge in order to bring down maternal mortality rates.
Dr. Maina, can I give you 30 seconds?
I think for us also to overcome this, we have to approach it from a rights-based kind of approach. Where we have the highest burden of maternal issues, we need to really focus and emphasize more on those areas where the burden is highest. Secondly is that we want also to highly invest in the areas that have been traditionally underserved over the years. There's also remote areas where the facilities are so sparsely placed, and we need actually to refocus our investment in those areas so that we can bring them to the same level as those countries that have quick, easy access to services.
All right. Thank you very much, gentlemen, for joining us on Morning Express this morning. Important subject, and good to have men talking about it, to just show that it's really all about all of us, not just a women issue, it's an all of us issue. And Dr. Abbas, Gullet, Mr. Saddharth, Chatterjee, and of course as well Dr. William, Maina with us in studio this morning. And thank you all for watching. It's been a pleasure to have you with us. It's minutes past our time out. So we'll go and we'll see you tomorrow. It's a big day, Kesho. We have the World Cup happening, the budget reading here in Kenya. So we have a very well planned show for you. We'll break down all the budgetary news for you as well as the World Cup. So you don't want to miss that. I'll also be wearing my jersey and you'll get to know, maybe not, who I'm supporting. See you tomorrow. Have a lovely day.